Hello, everybody. My name's Alane Freund. I'm a licensed marriage and family therapist, and I'm out in California. I'm here today speaking with my dad, who is a retired physician and microbiologist, Dr. Joe Freund in Oklahoma. Hi, Dad. Welcome.
Good afternoon.
I feel like this is the Alane and Joe show, and I'm so glad to have you back on. Now that you're a professional blogger, I thought it'd be good to catch up a little bit. It's been a while since we've done one of these videos on COVID-19. Are you ready for me to launch into my questions?
Certainly. I won't promise anything but effort at answering.
I like that. That's all we are promising, right? Okay, so there's so much about testing. I have a friend who has had a test ordered because she's been sick for a while, and it just made me wonder if you could just talk a little bit about what's the scoop on the COVID-19 tests? You know, which test does what? You know, which one should you get if you're going to get one? All
There are
that.
basically two different tests. One is called a molecular test, which means they're testing for molecules in the virus. It's looking for the virus itself. And if you've had contact with someone has and you're developing the virus in your body, once you get to that point, you will have the viruses in your air passages, and they take a swab, and some tests can now use saliva, and they take that sample and go to the lab, and they look for parts of the viral cells, or the virus in the cell, but looks for the parts in there. And if they find them, that means you have the virus in your body. The other test is called a serology test, meaning they take your blood and they look for antibodies. Antibodies are proteins made by your body in response to an infection. For example, if a virus, such as COVID or influenza, common cold, or many of the other viral illnesses is in your body, they can test for that. If you have a bacterial infection, they can test for that. And if you get exposed to one of these bacteria or virus, we call them generally antigens. If you get exposed to one of these, your body attacks it, recognizes it, and builds proteins to destroy it. Those proteins are called antibodies. They don't occur unless you have had the disease or been exposed. In most illnesses, when you're exposed and get sick, everybody knows it. In COVID-19, the sinister aspect of this virus is that you can be exposed and have this virus and never know it, or you can have mild symptoms. This virus is the great imitator. I think 100 years ago, they called tuberculosis, I think, the great imitator, because it can cause virtually anything. It can cause neurological symptoms, loss of smell, loss of taste, not waking up, being too sleepy. And that's just one aspect. It can also cause intestinal problems and all the other things. Well, if you get this virus exposed to you, let's say on day one, it's going to take 3 to 5 days before the virus is growing enough in your body to be detected. At that point, you can detect it with the molecular test or the virus test, but you cannot detect the antibodies. There's two types of antibodies. What they are doesn't matter, but one of them comes on pretty quickly. And if there's anyone scientifically minded, it's the IgM, and the other one is IgG. And the IgG comes on a couple weeks or so and lasts a long time. If you have these antibodies in your system and you get exposed to, or you would have gotten exposed to it, whether you had symptoms or not, you don't know if you never had them. A lot of people, a majority of the people exposed to this virus do not have symptoms. In some studies, they're thinking that for every one that gets sick with the virus and knows they're sick, there's 50 that had it and didn't know it.
Wow.
The
Can I ask?
Sure.
Oh, go ahead, sir. I wanted to ask you about false positives, false negatives on the test, because I've been hearing people wonder about that, be concerned about that. Do you know anything about that?
Well, first of all, there's several people making the test. I don't know the latest numbers, but there were 2 approved by CDC, and several that weren't, but they're approved to be sold. They're approved to be used. Well, the tests that I've heard, I haven't checked it out completely, that's most accurate. Well, there's a couple of them, but the Abbott test is what we call 99% specific. Specificity means it detects only what it's supposed to, and it's awfully close to 100%. If you get a positive with the Abbott test or the Quest, there's several now, and it tests positive for the COVID anti-antibody, then there's a 99 to 100% chance that it's not giving you a false positive.
But what about false negative?
Well, that's the other aspect. Not only is it a specificity, there's also sensitivity. And the sensitivity is in basically simplest form, the times it will give you a negative when you're really positive. So that's,
what's the point of even getting tested then?
well, the point is if you got a 99% chance of getting tested, that's very valuable. And if there's any question, you can repeat it. For example,
oh, you've got a 99% chance of getting a correct positive if it's positive.
Yes, I think it's even higher than 99, but I forgot the actual number. If you think you've been exposed or have an illness consistent with it and you test negative, you can repeat the test. And
what if you do have the antibodies? Does that mean you have immunity?
Well, that's the big question. The one thing I can tell you about COVID-19, the SARS-CoV-2 virus, is no one knows really much about it. You talk to the experts and they're making an educated guess.
Yeah.
No one knows how long this virus is going to last. Will it come back? Can you get reinfected? How long do the antibodies, if you get them, last? How much do the antibodies build in your body? Does one person make a little bit or a lot? They have no idea. But there's anecdotal reports of many people getting a transfusion. Now, if you have antibodies in your body against the COVID virus, then if you get those antibodies from someone else, it's been very beneficial. Some people have had incredible cures.
Wow.
And the way they do that is if you test positive for the antibodies, they can take your blood and transfuse part of the blood, 2 parts of the blood, liquid and blood cells and proteins. The red cells, which carry your oxygen, you give back to you, but you can donate your plasma with antibodies and be given to a patient who's sick with the virus. And if they're your blood type, it has a very good chance of killing the virus. But the government doesn't know what or how many.
Let me ask you something, because you have a viewership that's across the country at least. What do you recommend as the best way for someone to figure out how to get a test? First of all, who should? You're saying if they have symptoms that resonate with COVID-19 symptoms, it would be a good idea. How do you find out where to get a test? What would you recommend to people? I mean, is it just call your local doctor, your regular doctor?
That's a good place to start, or the health department. And there's now people advertising on TV, you can get the test, and they charge different amounts. The question is tests vary in their accuracy. You want to get a test from an established provider. We have a Diagnostic Laboratories of Oklahoma, for example, and physicians can even get some in-office tests now. But I think the best place you ought to start with any serious immediate questions is with your family physician.
I think that's a good place to take a pause, actually, because I know our video's gotten long. Do you want to make some wrap-up comments about testing, and then we'll make a separate one for some of my other questions?
Yes. If you have been exposed to someone that's probably or definitely got the disease, you should, one, if you live with someone who's at risk with the risk factors, chronic illness, immunodeficiency, then you should consider getting the test if you have symptoms. If you don't have symptoms, protect yourself and whomever you're with. No reason to get a test because you've been around someone, because if you isolate, as they recommend, for 14 days, you're good. What bothers me is people are going and getting their temperature tested, and that's a subject we probably ought to address another time. I'm not sure why they get their temperature tested if you don't have symptoms, because symptoms come on before the temperature. But you
Right.
go to a restaurant, they're going to take your temperature with the skin temperature.
What's the point? I
It's
mean,
what-
so isn't it true that long before you have a temperature, you can be transmitting the virus?
Yes,
So,
virus. In 3 to 5 days, you start developing it. Symptoms may never develop. They may be very mild. You may not know it. But after that 3 to 5 days, before symptoms is your most contagious time. And if you get a test today, you were exposed yesterday, so what if your test is normal? You don't know anything because tomorrow it could be positive.
right.
So basically, get a test if you have a reason to, not just a test.
Thank you so much. I think that really helps clear things up. And I appreciate you translating for us all this stuff that we see on the news, and some of it, we can't even tell what's true. So I really love that you're doing the research and you have the scientific mind to give us accurate interpretations, really, and translations of what we're hearing out there. So
No one
thank you so
knows
much.
the answers. You just have to be reasonable with your history and your knowledge.
If you find Joe Friend on Facebook, you can put comments or questions below this video or on YouTube, and we'll try to be sure that he answers them. Thank you so much for joining us. We'll be back with another one soon.